This is Dr. Ethan Lee, and in today's video, I'm going to be sharing some information about thoracic outlet syndrome. I'm going to be starting with, of course, what it is, and then we're going to talk about some symptoms and complications. After that, we're going to talk about some anatomy of it. And in the end, I'm going to be sharing some alternative treatment options other than medication and surgery. Alright, let's get to it. So, what is thoracic outlet syndrome? To understand that, first we need to understand where thoracic outlet is. So thoracic outlet, if you look at this picture, is around this area at the front of upper part of your chest. But thoracic outlet is not really classified by this diamond-shaped area, it's just where it's located. The physical location, if we look at anatomy, is located between your collarbone, the clavicle, and your first rib. So the tiny space in between, that is the thoracic outlet. And what goes through the thoracic outlet are blood vessels and the nerve plexus that are supplying and innervating your muscles of your whole arms and your shoulders. So if the thoracic outlet is compressed for any reason, it can cause a variety of issues in your shoulders, arms, hands, and even your fingers. Symptoms of thoracic outlet syndrome includes pain and tightness in your shoulder, muscle weakness, numbness and tingling sensation that goes down to your arm. People who suffer from thoracic outlet syndrome can also be experiencing complications like frozen shoulder, decreased range of motion in your all upper extremities, elbow pain, wrist pain, or carpal tunnel syndrome. So if you or anyone you know got diagnosed with thoracic outlet syndrome, that only means that you have compression at your thoracic outlet. But what is causing the compression to happen? Now, let's take a closer look at our shoulder's anatomy. The shoulder is a very complex joint. It is the most mobile and flexible joint in our whole body. Why is that? If you look at the anatomy again, this is the collarbone. You attach to the scapula or shoulder bone and our humerus, that's the upper arm. Okay? And our whole arm and shoulder, including the scapula, is only anchored to our body by one joint. Yes, just one joint, and that joint is the sternoclavicular joint. That's the only joint that connects the whole arm to our body. Now, if you look at the side view, you can see there's no contact between your scapula and your ribs. If you look from the back, you can see the same thing. There's no contact. The only contacting point is the front sternoclavicular joint right here. Now, what does that mean? That means the position, the movements, the stability of your whole arms and shoulders are dictated mostly by your muscles. There are muscles that pull your clavicle up, like trapezius muscle or SCM muscles. There are also muscles that hold it down, like your deltoid or your pec major. Now, this looks like there's only a couple that's dictating it, but remember, muscles comes in layers. And if you just simply peel off one layer, you see the pec minor is exposed, the intercostal muscles are exposed, and there's the serratus anterior, some of the bicep muscle that's also controlling the whole shoulders. Total, there will be about like 15 to 20 muscles that are contributing to the balance of your shoulder. I see thoracic outlet syndrome as a result of incoordination between your muscles. Some muscles might be hyperactive, that means it's pulling too hard. Some muscles might be hypoactive, that means it's not pulling enough. So when the balance of your muscle is disturbed, it can create structural issues like thoracic outlet syndrome and many other musculoskeletal issues. Now here, in Northwest Structural Medicine, I utilize neurology and kinesiology muscle tests to test each muscle individually to identify the core issue of your problem. And then, from various treatment options, we pick up the most effective one that can best address your problem. Aside from treating the local pain point, I also focus on finding out the root cause of your issue. So not only do I try to get rid of the pain, I also want to make sure that the pain never ever comes back again. But remember, everyone's body is very different. So even though the symptom might seem similar, the root cause can be very different upon each individual. Alright, that's all for today. I do hope this video offers some useful information for you to understand a little bit more and a little bit better about your own body, because I do think that is very important. I want to thank you all for watching and finish this video. If you have any question, please feel free to visit my website. It's Northwest Structural Medicine, or click on the link below. Now, I will see you next time.